Welcome to Flourish Nursing Academy. This is Tutor Godwin. We will continue with Part 2 of Antibiotics, and we will start with Carbapenems, a class of V-lactam antibiotics with a broad spectrum of antibacterial activity. Highly resistant to most V-lactamases, active against both gram-positive and gram-negative bacteria and anaerobes, with the exception of intracellular bacteria, atypical, such as the chlamydia. Agents: imipenem, cilastatin, TNM, meropenem, meronem. Adverse effects to carbapenems include upset, phlebitis, hypotension, seizures in renal dysfunction, headache, rash, GL patients with monobactums. They are V-lactam compounds. They work only against aerobic gram-negative bacteria, Neisseria, Pseudomonas. The only commercially available monobactums antibiotic is aztreonam, azactam. Adverse effects to monobactums can include skin rash and occasional abnormal liver functions. Macrolides. Macrolides are bacteriostatic, binding with bacterial ribosomes to inhibit protein synthesis. Macrolides antibiotics are used to treat respiratory tract infections such as pharyngitis, sinusitis, and bronchitis, genital, gastrointestinal tract, and skin infections. Macrolides antibiotics are erythromycin, erythrocin, clarithromycin, Classid, azithromycin, Zithromax, roxithromycin, roxacin. Macrolides side effects: nausea, vomiting, diarrhea. Infrequently, there may be temporary auditory impairment. Oral erythromycin may be highly irritating to the stomach, and when given by injection, may cause severe phlebitis. Macrolides antibiotics should be used with caution in patients with liver dysfunction. Pregnancy Category B: azithromycin, erythromycin. Pregnancy Category C: clarithromycin. Ketolides, antibiotics belonging to the macrolides group. Much broad spectrum than other macrolides. Ketolides are effective against macrolides-resistant bacteria due to their ability to bind at two sites at the bacterial ribosome, as well as having a structural modification that makes them poor substrates for efflux pump-mediated resistance. The only ketolide on the market at this moment is telithromycin, which is sold under the brand name of Ketek. Lincosamides, e.g. lincomycin, clindamycin. Lincosamides prevent bacteria replicating by interfering with the synthesis of proteins. They are normally used to treat staphylococci and streptococci, and have proved useful in treating Bacteroides fragilis and some other anaerobes. They are used in the treatment of toxic shock syndrome. Lincosamides antibiotics are one of the classes of antibiotics most associated with pseudomembranous colitis caused by C. difficile. Aminoglycosides. The aminoglycosides are bactericidal and work by stopping bacteria from making proteins. Tux and aminoglycosides antibiotics are used to treat infections caused by gram-negative bacteria. Aminoglycosides may be used along with penicillins or cephalosporins to give a two-pronged attack on the bacteria. Since aminoglycosides are broken down easily in the stomach, they can't be given by mouth and must be injected. Generally, aminoglycosides are given for short time periods. Aminoglycosides group includes amikacin, amikin, gentamicin, garamycin, neomycin, neomycin, streptomycin, streptomycin, tobramycin, nebsin. Aminoglycosides side effects: ototoxicity, nephrotoxicity. Aminoglycosides are classed as Pregnancy Category D, Floroquinolones. They are synthetic antibiotics, not derived from bacteria. Floroquinolones are broad-spectrum bactericidal drugs that are chemically unrelated to the penicillins or the cephalosporins. Floroquinolones inhibit bacteria by interfering with their ability to make DNA. This effect is bactericidal. Because of their excellent absorption, fluoroquinolones can be administered not only by intravenous but orally as well. Fluoroquinolones are used to treat most common urinary tract infections, skin infections, and respiratory infections, such as sinusitis, pneumonia, bronchitis. Fluoroquinolones group includes ciprofloxacin, cyprobe, ciprocin, levofloxacin, Tavanec alpha-cef, norfloxacin, noracin, ofloxacin, Teravid, moxifloxacin, Avalox. Fluoroquinolones side effects: nausea, vomiting, diarrhea, abdominal pain. Irreversible damage to central nervous system uncommon. Tendinosis rare. Fluoroquinolones are classed as pregnancy category C, trimethoprim sulfamethoxazole, or Co-trimoxazole, an antibiotic used in the treatment of a variety of bacterial, fungal, and protozoal infections. Co-trimoxazole is generally considered bactericidal, although its components are individually bacteriostatic. Its actions are antifolate in nature, inhibiting both de novo folate biosynthesis and metabolism. Co-trimoxazole side effects: nausea, vomiting, an allergic reaction and infection with Clostridium. Difficile, a type of diarrhea. Co-trimoxazole is classed as pregnancy category C. Some state it should not be used during breastfeeding, while others say it is okay. Tetracyclines. Broad-spectrum bacteriostatic agents and work by inhibiting the bacterial protein synthesis. Tetracyclines may be effective against a wide variety of microorganisms, including rickettsia and amoebic parasites. Tetracyclines are used in the treatment of infections of the respiratory tract, sinuses, middle ear, urinary tract, skin, intestines. Tetracyclines also are used to treat gonorrhea, Rocky Mountain spotted fever, Lyme disease, typhus. Their most common current use is in the treatment of moderately severe acne and rosacea. Tetracycline antibiotics are tetracycline, doxycycline, vibromycin, minocycline, oxytetracycline, oxytetracid. Tetracyclines side effects: cramps or burning of the stomach, diarrhea, sore mouth or tongue. Skin photosensitivity. Allergic reactions. Tetracycline antibiotics should not be used in children under the age of 8 and specifically during periods of tooth development. Tetracyclines are classed as pregnancy category D. Use during pregnancy may cause alterations in bone development. Chloramphenicol. It is a bacteriostatic. It is considered a prototypical broad-spectrum antibiotic alongside the tetracyclines, and as it is both cheap and easy to manufacture, it is frequently an antibiotic of choice in the developing world. Effective against a wide variety of gram-positive and gram-negative bacteria, including most anaerobic organisms. Due to resistance and safety concerns, it is no longer a first-line agent for any infection in developed nations, with the notable exception of topical treatment of bacterial conjunctivitis. Chloramphenicol side effects. The most serious adverse effect associated with chloramphenicol treatment is bone marrow toxicity. Use of intravenous chloramphenicol has also been associated with gray baby syndrome. Other less serious reactions include fever, rashes, headache, confusion.